Right now, it's an exciting time for kidney cancer, but however, there's still a lot of work to be done. You know, the greatest unmet need is we are helping patients, but we're only helping a subset of patients. There's still a great majority of patients that do not respond to the therapies or that progress pretty rapidly. For example, in immunotherapy, it is wonderful. It's shown to have a great response and great survival benefit, but only a small majority of patients respond, about 20%. And we need to make sure the rest of the 80% are taken care of. In patients who respond to oral targeted agents, they respond for only a brief amount of time and they move on to the next therapy. So we need to make sure that we're helping more patients, that we're able to potentially cure some of the patients with immunotherapy, but we hope to cure more patients with immunotherapy in the future. And what's exciting is now we have a lot of clinical trials that combines immunotherapy plus targeted agents, as well as other novel agents for kidney cancer. So maybe a cure is on the horizon for these patients, as well as patients that have stage 3 disease, and we want to prevent the cancer from recurring. And that's another area that we're trying to work on. We do have a drug approved for these patients, but it is highly toxic and most patients prefer not to take it. So it is a discussion we make with them. Right now, there's a lot of clinical trials that's ongoing for these unmet needs, a lot of exciting combinations, immunotherapy plus targeted agents, a lot of novel agents that's been combined with immunotherapy. So we can capture better patients and help more patients, not just a subset of patients. Finding more molecular targets to approach. You know, when I see a patient, I do genetic sequencing, and sometimes we pick up mutations that we're able to target. So finding better targeted therapies for patients, combination therapies, can all help meet these unmet needs for patients. The one that we have is the targeted immunotherapy and combination with an oral targeted agent that's shown to be very effective. And in the coming years, probably in the next year or so, the data from combination oral agent plus immunotherapy will read out, and it might be the next new standard of care to treat kidney cancer is using combined agents instead of single agent, either targeted or immunotherapy. And that is coming out very soon in the horizon. For me, it's very gratifying now in 2018 to treat kidney cancer because the field has moved very dramatically. If I were to treat kidney cancer 20 years ago, you know, there's not much options we can give for patients. But today, there are so many options that are available. Patients are doing well, they're living longer, and with these advent of newer targeted agents, combined agents, immunotherapy, it's really gratifying for me to treat kidney cancer patients because they are living longer than the projected survival that's set out for kidney cancer. So I'm very excited to treat these patients because we have a lot of options.